A new study is shedding light on the growing health crisis in rural Georgia, highlighting how access to care is becoming harder for thousands of residents.
WJCL 22 News' Kirsten Maselka explaining what is driving this issue, why experts are telling you, Kirsten, that the solutions may not be just one size fits all.
That's right, Greg, Shannon. When you think about issues facing rural communities when it comes to accessing health care, you may first think of distance. In coastal Georgia, some may drive over an hour or more to reach hospitals like this one here in Savannah. But now a new study released today says that here in Georgia, problems go beyond just driving and distance, and some providers are calling for change. New research released Thursday finds the roughly 663,000 Georgians living in rural areas are facing layered vulnerabilities when it comes to health care. In coastal Georgia, affected areas include Bryan, Evans, and Tatnall counties, among others in the region.
The biggest drivers aren't distances alone. It's very high chronic disease and economic pressure stacking up and actually piling up all at once on an already fragile healthcare infrastructure.
Led by the Parkland Center for Clinical Innovation, the study cites factors from high rates of chronic illness to hospital closures, even pointing to everyday barriers like income, food access, and health insurance.
Over 90% of Georgia rural tracts have very high vulnerability to coronary heart disease. Over 80% for diabetes.
Even telehealth isn't always an option. According to the study, 75% of Georgia's rural areas are highly vulnerable for connectivity.
A lot of our rural areas, internet is an issue.
Nancy Herlock, a coastal Georgia nurse practitioner, tries to fill that gap by seeing rural patients at their home. She says the barriers featured in the study all intertwine.
It becomes very much of a vicious cycle.
While some areas may have access to basic care, Herlock says trouble comes with more complicated conditions.
There's a patient I'm working with right now. They live in a very rural area and they need endocrinology, for an example. We don't have endocrinology that they can access. So the chronic disease is undermanaged or poorly managed. Then they're back into the very healthcare system.
MIF says the problem requires finding area-specific solutions.
Urban solutions do not solve rural challenges. We have to stop guessing and to start designing them around those local, unique challenges.
However, Herlock says the solution already exists, but state policy is the barrier.
We are the last state that doesn't allow nurse practitioners to order home health care. We have to wait for a physician to write an order.
Georgia law requires nurse practitioners like Herlock to get a doctor's signature before implementing certain types of home health care. Herlock says changing that one factor would be a game changer for her rural patients.
If we would just release the restrictions in the state of Georgia and allow nurse practitioners just to do their job, we would impact health care immediately.
And rural healthcare disparities have taken a center focus in Georgia's 2026 election cycle, with some candidates featuring it as a center pillar to their campaign.